Hey you guys, it's Karen Tays here again, and I totally had a brain fart and thought my last speech was due today, so it's late and I look horrible. I've been to the gym, I've been working for the last 2 weeks straight, so it's my first day off. So anyways, I'm going to do my persuasive speech, and I'm going to do it on ovarian cancer. Although it's not really a cultural or global belief or practice, this does impact many people each year, and so I thought I would talk on ovarian cancer. This topic is near and dear to my heart because in 2005 I lost my mother to ovarian cancer. And it's been very difficult to overcome the loss, and it saddens me because if it had been caught early, my mom would still be here today. So since the loss of my mom, I have felt it my duty to try to get the word out there in hopes that others will not have to experience this great sorrow. Ovarian cancer is very treatable if it's caught early, but normally it is not caught until it's in the later stages, which makes it a very fatal type cancer. Let me give you some information about ovarian cancer. Of course, it's from the ovaries, starts in the ovaries. It's a very slow growing cancer that eventually will cover the entire abdomen and go into the chest cavity. Unlike breast cancer, there's no self-exam that you can do to hopefully diagnose it early and start treatment. And most of the time, it completely has covered the abdomen and moved into the chest before the patients have signs and symptoms. Therefore, it's in the later stages once it's diagnosed. Let me give you a little bit of background about who's at risk for ovarian cancer. It is women, of course, who have a family history of not only ovarian cancer, but a family history of breast, uterine, and colon cancer also increases the risk. Women that are over 55 and women that have never been pregnant also have an increased risk of ovarian cancer. The signs and symptoms are very subtle and therefore go undiagnosed for a long time, just as my mother did. She had very subtle signs and symptoms for years, and even with me being a nurse, I had no idea, and we just totally ignored them. Unfortunately, it was to her demise. The signs and symptoms are abdominal pain, bloating and swelling, which women doesn't have that. So, it's easy where it's easy to see where you can totally ignore that. They also have an increase in nausea after eating and increase in digestion, which again, like I said, comes with the older age women over 40. Also, they have an increase in gas and constipation. Then they also will find that they have an irregular menstrual cycle, which again, with a woman over the age 55, they think they're going through menopause. So that was another symptom my mother had that we totally ignored. She was diagnosed with multiple gastrointestinal problems, and that was where they actually found that it was ovarian cancer that was causing all the gastrointestinal problems. They also say that feeling tired all the time is one of the symptoms, and the National Cancer Institute of Research actually, their slogan for ovarian cancer is "Listen because it whispers." So I did a little research to hopefully try to prevent or find out how we can prevent or diagnose this type of cancer early. And what I found was, as it stands right now, most of us know that insurance companies pay for our annual checkups as females. This includes a pap smear and a mammogram. Unfortunately, what most people don't know is that the screening for ovarian cancer is not included in this exam. There are two ways to diagnose ovarian cancer, one of which is a blood test, and it's called a CA-125. Unfortunately, this is not a definitive test. That means that when the test comes back, you may have ovarian cancer, it may have a negative result, or it also may have a positive result. Now, what it will tell the doctor is that if it is an abnormal blood test, then it will alert them to do a further exam, which would be an abdominal ultrasound. The abdominal ultrasound is a definitive test, which means that once you have that test done, it will tell you if you have ovarian cancer or not. So what I found out was the CA-125 it costs around $5 to $15 once your insurance pays. The thing is, though, is you have to ask your doctor for it. They're not going to recommend that you have it done. I have tried to get the lobbyists in Tallahassee to lobby this so that insurance companies in Florida would pay for this along with the mammograms and pap smears. Unfortunately, right now, their major stand is for lung cancer and breast cancer. One, because breast cancer, they can detect it early with self-exams, and then lung cancer they know is directly caused by smoking, and therefore if they can get people to stop smoking, they can eliminate lung cancer. So ovarian cancer is on the back burner, although there is a great foundation out there, the Gilda Radner Foundation. You know, Gilda Radner from Saturday Night Live did pass away of ovarian cancer, and her husband has set a huge foundation to do all kind of research and fundraising for ovarian cancer and ovarian cancer survivors and their family members, because what they found is there is a greater chance in a family member getting ovarian cancer. So I just want you guys to, I hope you found this interesting. I know it wasn't some great belief or practice for the global unit, but I just hope that you'll put these signs and symptoms and remember this in the back of your mind, and so someday if yourself or a loved one has these same symptoms, that you don't ignore them, that you'll seek treatment immediately, and that you don't have to go through the same thing that my mom and I went through. So enjoy.